Hello all, welcome to our first 2020 Pine Chemicals Association webinar. This is the first of a series of webinars we planned for this year, and we have postponed our annual meeting and international conference for 2021. These meetings are going to be held in the same places planned for this year at similar stage. We will keep you posted about this. Before going into the webinar, let me remember you that PCA follows strictly its antitrust policy that states that there must be no discussion related to prices or term of purchase or sales of products PCA members buy and sell, or of any other matters which might inhibit the competitive workings of the free market, including actions which may divide markets or create boycotts. Maintaining and enhancing the safety and well-being of workers is one of the pillars of the Pine Chemicals Association Ethical Principles. So we understand that under these circumstances, we should tackle in this first webinar COVID-19, doing an update and discussing current best practices. We have invited the members of our EHS committee for this task. So today we have as panelists Joel Anderson, Hugh Parker, John Myers, and Dave Neely. Without further ado, I'm going to ask the four of them to introduce themselves. Joel, please, can you introduce yourself?
Thanks, Alex. Hi, I'm Joel Anderson. I'm a consultant for PCA, and I provide technical and professional support for the PCA Environmental Health and Safety Committee.
Hi, I'm Hugh Parker. I'm the currently safety manager with Plasmine Technology Incorporated, and I'm also the PCA, the EHS Committee Chairman.
I'm John Myers. I'm the Health and Safety Manager for DRT America, and I'm the PCA EHS Committee Vice Chairman.
And Dave?
Yes, sir. Thank you, Alex. I'm Dave Neely, work for our boss. I'm the Director of Environmental Health and Safety and Regulatory Affairs. I've worked with the EHS Committee for the past 14 years, and I trust that we'll give some high value information here as we work through this COVID-19 event. Thank you, Alex.
Thank you all, and just let's dive into the webinar, and I'm going to handle the control to Joel. Joel, you are now the presenter.
Okay, all right, give me a second. All right, you should see the presentation now.
Yes.
Okay, well, let's talk about COVID-19, and as I go through this, the other panelists will chime in as we go along and see what they are doing at their facilities. It's a changing situation, but the current status is chemical manufacturing in most states, and probably all states, is likely an essential business under stay-at-home orders. And what we've learned and found is that our emergency response plans, which we have for many scenarios that can occur, rarely included planning for pandemics. So we've had to be very quick on our feet with this thing. This pandemic is spreading in some states, declining in others, and the medical recommendations change as time goes on. There's also governmental directives, and they're changing, and clearly our business has been interrupted. I talk about things are dynamic and changing. We must stay abreast of all the medical, legal, and business guidance to stay current with this. Looking at the legal backdrop, there's no direct legislation regarding COVID-19. However, OSHA has issued guidance, but no specific regulations. However, there is the general duty clause, which is a regulation that applies, and it's our responsibility as employers to provide employees with a workplace free from recognized hazards likely to cause death or serious harm. There's also CDC recommendations, which are valuable to keeping the workplace safe, but again, no direct legislation. Our job is to prevent spread in the workplace, and if you didn't have an emergency preparedness plan before, you have one now to execute in response to this pandemic. But it's about enforcing and highlighting hygiene, cleaning, disinfecting, also PPE, face masks, face coverings, structural barriers like plexiglass between employees or plastic, other engineering controls. Thinking about staffing to limit interaction of employees, to limit how many employees may have to go into a control room, providing work from home options when practical. And then thinking about not only employees, but visitors, to screen them with signage, temperature checks, and other methods that we'll talk about some more with the panelists. But regarding cleaning, just a reminder that if the OSHA hazard communication standard has an exemption for normal household cleaning products. However, that's when used in a similar way that you would use them as a consumer at home. But if you're using large volumes, more frequently, longer periods of time, consider adding those cleaning and disinfecting products to your hazard communication plan. And then there's guidance on preventing the spread through good hygiene, covering sneezes, hand washing, face coverings, face masks that we'll be talking about. Let's talk about PPE, and would like to hear from the panelists. There's some non-required PPE that may be helpful in preventing the spread: the gloves, the gowns, face shields, masks. And OSHA provides guidance, has provided guidance document on this, and there's 4 categories of risk. The high and very high would apply to the medical profession and those in close contact with sick, but for chemical industry, we would fall in the medium and low risk categories as indicated in the guidance. But it is about the hygiene, the PPE, and the separation. And then there's other physical barriers such as structural, relocating equipment to spread things out, indicating paintings and markings, improve ventilation, air filters. An interesting one that I know one member company is doing, maybe others, and we'll talk about it, it's elimination of shared food and shared appliances, like no candy dishes, no shared refrigerators, no coffee makers that are shared. So I'd love to hear from the other panelists. What of this rings true to you, and what other things might you be doing?
Yeah, Joel, what we're doing here at Plasmine, we have provided face masks for our employees. Now, we have not made it mandatory, but it's an option. We have issued those out, and we've also brought in enough of them to allow them to take some home to their immediate family members as well. That's one thing we have done with PPE.
At DRT, we've gone the mandatory route. Anytime you're within 6 feet of another person, you're required to be in a mask. We pass out our surgical masks when we come in each day. We are doing the temperature checks, which we'll talk about later as well, in order to kind of do that initial screening coming on site. We have not gotten into gowns or requiring gloves, but as of right now, the masks are our primary protection.
Yeah, and let me just say that we're still working out some of these details, but we've had a a formal screening process in place since the 1st of April. But at the same time, we're working out the same kind of details as far as if you can't maintain social distance, you should probably have a mask on. We're still working out those details as far as what's mandatory and what's not. We do want to make sure that we provide good protection to keep this. I mean, I think from our perspective, OSHA requires us to keep the hazards out of the workplace. So we got to have some things in place to, it's just best practice. So we're working some of those out, but everything you mentioned here is basically what we're looking at, and along with additional signage. We're talking about effective signage, not having so much signage, it becomes part of the paint. So all those kind of things are, where we also have on the table. And I'm with this group, I'm willing to share all that we brainstormed through mud on the wall, and now we're sorting it out and hope to have that ready to go by next week, because our plants are getting ready to come back up here in June.
Okay, good. One question, I assume you're considering face masks not a respirator, not part of a respiratory protection program, but they're face coverings and not part of a respirator program?
Correct.
That's correct. That's correct.
Yeah, that seems to be the way.
Well, let me just, we do have plants though that are respirator trained, and we're kind of weaving that into also the protection, because they do have FR face coverings, but we're working that out to whether or not we want to have our employees just wear their personal respirators if they're out and working in the process tower, or if they're or we want them to have face coverings.
Okay, good. Let's moving on. Another area where we can prevent the spread is staffing considerations. For example, things that give us social distancing. It could be staggering shifts and so forth. But looking at it from a high level, it's best practice to have a crisis management team. It just may be your plant management team or your corporate team, but having a crisis management team to lead the effort for your company, staggering shifts or some other alternate schedule, limiting how many people can be in a common area like a locker or break room. And I know some facilities have limited who can go in a control room, made those kind of a special areas that limit employees who may otherwise go in there from time to time, rearranging duties just to prevent people coming in contact with each other and so forth. And of course, teleworking for employees that have the ability, and having flexible leave policies so that folks who are sick can stay home and not try to be heroes and come in when they're sick and spread the disease. So other thoughts on what you guys are doing?
Yeah, Joel, here at Plasmine, we've implemented several of those bullet comments you have there in the presentation. We have staggered our shifts. We've actually moved away from a night shift and an extended day shift. Also, we're allowing our admin group to alternate weeks at work to limit the number of employees on site. And our corporate group, they're teleworking, they're working from home and able to handle their duties from there. So kind of a mix of those recommendations there that we've implemented.
At DRT, we've not altered our scheduling from a production standpoint. We're still running our 24/7 operation. Our personnel that are able to telework or work from home have been given the ability to do so, and that has been fairly successful, I believe, with limited interruptions to our productivity. Meetings have been pretty much suspended, and unless we can maintain the social distancing requirements that we've put in place, And from a staffing perspective, we've also added a nurse through a third party to come on and do the temperature checks, as well as some dedicated personnel for disinfecting common areas.
Yeah, that's pretty much, you know, we've had everything that we're considering here. We are, the temperature checks that we'll be doing will be self-taken, and they will log that on their sheet that they'll turn into the site when they come on site. They won't record their temperature, they will record that it's below 100.4 degrees. But other than that, I think everything here pretty much applies to what we're doing. We do two things. We are requiring the folks who can do their work from home will stay at home, and to try to keep as few people in the plant as possible. And that's pretty much it, I think, for what where we're currently at in our decision making.
Okay, good. Thanks, Dave. Moving on, and we're going to talk some more about temperature measurements in a minute that Dave brought up. But as far as screening employees and visitors, some best practices are, again, potential signage. Dave, I like your comment that you can have so many signs that they become part of the paint. So true. But we're going to talk more about temperature checks on a subsequent slide and the best way to do it. And there are some pitfalls we have to look out for. But some other best practices are to confirm the non-employees, the contractors, the delivery drivers have their COVID precaution programs in place, and they're doing their screening of employees on a daily basis and have some confirmation they can provide to you. Same with visitors, and only have those that are necessary on your facilities. So, and then perhaps limit them to specified areas. So any comments on employees, visitors, truck drivers, delivery drivers, and how you folks are handling them, contractors?
Something that we've done. Oh, go ahead, Hugh.
Go ahead, John.
Something that we've done at DRT, the way that our facility is laid out, we actually have the ability to have multiple entrances for different groups. So we've had to redirect traffic to funnel all personnel into one location to allow everyone that's coming into the site to be checked. We've done the signage. You know, we've got the sandwich board up there, kind of telling people that we're doing mandatory screenings. We have the sign on the building itself telling people where to go in. From a check perspective, we've seen that there has been some hesitation with people. If we're not actively requiring them to come in and get it done, there are still those that will try to avoid it, whether from an infection concern or worry that they may have it themselves. I don't know, but it's been something that we've had struggles with. Having the nurse take the checks themselves, it kind of helps us from a HIPAA perspective. We're not seeing the information that would be classified as personal health information, and having some other challenges around the equipment itself. That has been a struggle, seeing that, you know, some people may come in and they'll do your initial check and tell you that you have a temperature of 93 degrees. You know, congratulations, you're already dead. But the ability to see it up front and help people, I guess, know that they're healthy coming in at that moment, that kind of gives a lot of relief to our employees.
Okay, thank you. Any other comments?
Well, we're continuing to follow the guidelines of only necessary contractors, delivery drivers, vendors coming in. We're screening those as well, doing self-checks with a non-contact temperature, thermometer. So following the same guidelines.
Okay, good.
Same here.
All right, just a few more. I know we've talked somewhat about temperature checks, a few more comments here. The devil's in the details. It can be considered a medical exam, so if possible, have a professional do the testing or do the self-measurement with at home where they come in and attest that below a certain value. If you do self-measurement at the entrance, then there's the issue of sanitizing between users. So any further comments about temperature checks?
No.
Okay, yeah. Another point to make is have the same policy for all workers. You don't want to be singling out individuals to check their temperature. You want to have a consistent way for all employees, and ideally have contactless thermometers so you don't run the risk of spreading. And I talked about the at-home checks and then signing documentation, and I do agree it's best to have documentation that you retain that indicates they're below a certain number rather than record the actual temperature. A few comments about if an infection occurs in the workplace. It's about cleaning and disinfecting, reporting and record keeping requirements may or may not apply, and we'll talk about the details, and informing the workforce. There are guidelines for cleaning and disinfecting from CDC, and it's best to use an outside professional firm to do that with all the right PPE. And there's some guidance from OSHA, especially from an April 10th guidance, that in general, an illness would be OSHA recordable if it's contracted and confirmed at the workplace, but with community spread, it's very difficult to know where that illness occurred. So for our industries, it has to be very, very obvious that the contact, the spread occurred at the workplace, and that we were, as employers, aware of that. So in general, it would not be recordable for our industry, but for healthcare, emergency response, and correctional institutions, then the assumption is it did occur in the workplace, it would be recorded. But if you search for the OSHA guidance from April 10th, it does a good job explaining that in detail. It's also, obviously, you would remove the infected employee from the workplace, do some contact tracing, and notify the workforce. And the best practice is not providing the individual's name, but do through contact tracing, you have to at least identify those individuals and make sure that they are not also infected. But and then maintain confidentiality requirements. Have we had any cases of infection at your locations that you're willing to talk about?
We have not had any employee infections within the workplace. We have had some employees who may have had secondhand contact with someone who tested positive, but they never developed any symptoms themselves. So we've kept a close eye on that. We do have some employees whose spouses are in the healthcare industry, but they have not had any positive testing on their side either. So we're looking good here.
Good.
We're the same here. We haven't had any positive cases.
Good.
Same with divorce, none.
Okay, in conclusion, we just have to, as an industry, keep abreast of changes in the pandemic and changes in the recommendations and the actions. The legal standards are unclear. However, the OSHA General Duty Clause is forefront, in addition to I'd say moreover, our own personal and ethical belief of having a workplace that's safe for our employees, first and foremost. There's possible legal claims to arise in the future. As you know, due to workers' comp, employees typically cannot sue the employer. However, if they in turn infect a family member, the same protections don't apply to the family member for suing the company. There's also potential liability down the road if there's an allegation that contamination of our product caused an infection, or a delivery person contaminated someone in our facility. So it's going to be a legal confusion in the future. Going forward, we should look at our insurance coverage and also contractual protections, indemnification going forward. So again, it's staying abreast. And what you've heard a lot of is differences that the panelists are taking, which is natural because our plants are different. And we need the flexibility to adapt to our current situation for each plant, how it's laid out, and how densely the employees are gathered or situated. So the flexibility is important. And then communicate, strive to over communicate. And we didn't really touch on it, but I know a lot of companies are having regular emails, communications with their employees to let them know that we appreciate the extra effort and sacrifices that they're going through. And so communication is critically important. Any final comments? Yes.
Yeah, I have a comment on that. I have a quick question. Are you guys maintaining live webcams? In other words, are your webcams staying live, or are they locking on a picture? Anyway, a quick comment to communication. Over the years with injured employees, I've found if you don't stay in touch with them on a regular basis, at least weekly, their morale begins to drop. They feel displaced. They feel disconnected. So we took a very aggressive stance early on in making sure we're touching our team members, because we're down. They're at home except for just a few people. We're maintaining fire watch status at the facilities. So this communicate. I can't. That's absolutely so critical in keeping your team members engaged, keeping them feeling they're part of something, that they're not into a black hole. I mean, I know this sounds very basic, but hey, at the end of the day, we're all very basic people, and those touches on a regular basis are critical to keeping them where they need to be mentally when it comes to their work. Thank you.
Okay. Thank you. Any other comments?
Nope.
Okay, well, I'm going to turn it back over to Alex.
Well, thank you very much to all of you. It was very, very interesting and informative. Okay. Here in this slide, you can see the information of the panelists, Joel, Hugh, John, David, And I'm sure they are going to be pleased to answer any further questions that you have about COVID-19. And by the way, the EHS committee, PCA EHS committee, has two very interesting programs running. One is the EHS award, and the other one is the annual injury and lost time reporting. Maybe you guys can give some insight of what these programs are about. Joel, can you help?
Yeah, I'll start, and I'd like for you to chime in as well. But we structured the awards program to look forward, not to look backward at injury rates and things of that sort, but to look forward at the proactive things that that an employee is doing, that a leader is doing, that a facility is doing, and recognize those proactive activities that will prevent future accidents. And we know that there are a lot of people doing a lot of amazing things in the environmental health and safety fields, and it's about taking the time to describe what they're doing and submitting that, and then we recognize those folks. So, can you comment on that?
Yes, we usually do that, recognize that during our international conference. This year we are not going to hold the international conference, but we are going to find a way to cover
Yes,
for that.
we'll find a way to recognize.
Yeah, yes.
I'll just say that one of the highlights of my safety career here with Plasmine was receiving this Employee Excellence Award at one of the conferences. So I would encourage any member company out there, if you have an employee or a facility or a leader who deserves recognition, take the time to fill out the application, submit that person for as a recommendation, and give them the opportunity as well. There are many things that are going on out there that people are doing in the safety field that need to be recognized. And so I just encourage you. I know how I felt receiving this on the stage being presented. It's a good feeling that you're accomplishing something in the safety world. So I encourage you to submit those recommendations, and let's recognize those people.
You can access through our webpage the EHS Committee Award candidate list.
Alex, I also comment on the annual injury and lost time reporting program. And it's very simple. And we ask that member companies each year report to PCA their man hours and injury rates. We only share the data collected in aggregate for all the members. We don't share any individual companies' data, but we're able to look at that aggregate number and compare it to the chemical industry to see where we stack up compared to the general chemical industry. So it's useful and for that purpose.
Joel, we have in our database the reporting of 9 PCA members from 2015 to 2019. And I think that could be a very interesting short webinar that we can record, both of us showing what that data is showing. No?
Yes. I want to one last comment on the awards. I'm going to circle back to that for a minute. There was a couple of years ago a misconception that this was just for U.S.-based members of the association. That is not true. It is for all members internationally. And in fact, our facility award was one of the facility awards was for an international company outside, I think in Brazil. Yeah. So it's truly international.
Any other comments, you, Joe, and Dave?
No, I think the only thing I would say, I'm kind of jumping off of what Hugh said, use the opportunity for the awards program to find that individual, at your individual locations that is giving a, an extraordinary effort and award them. And part of the process of what I found over the years, part of the process of putting together the information as to why they are extraordinary is also a very interesting journey for, in my opinion, for the company, because looking at those items and then you begin to look at what other people are doing, and you're seeing, it shows you things as a professional that you may not have seen. So it's a really good opportunity when you capitalize on the awards program.
Yes. Well, I want to thank you all very, very much for this, to help me produce this first webinar of the 2020 series for PCA. And next week, May 21st, from 9 to 11, we are going to have a live webinar. And this is going to be because of our PCA annual business meeting. We have one presenter scheduled. This is Martha Moore from ACC, that is going to talk about the global economic and chemical industry situation today. Martha is a regular presenter in our conferences, and she always brings very, very interesting information about the economy and the chemical industry, and I think that today that is very important. Well, thank you all guys again, and thank also for the work that you are doing for the EHS committee. Thank you.
Thank you, gentlemen.
Thank you, Alex.
Thank you. Bye-bye.
Bye-bye.